does it feel?
It feels pretty good, actually. Thank you.
Registered nurse Kat Martinez is literally Bernie Farber's right hand. The 67-year-old attorney suffered a stroke that paralyzed his right side, leaving him homebound.
It's very important. I mean, I really think that without a nurse coming in, that they wouldn't be able to manage themselves at home.
Kat now does what Bernie's damaged limbs cannot. She changes bandages and helps him manage a constellation of chronic illnesses, diabetes, high blood pressure, and swelling that causes life-threatening infections in his legs. Without Kat, Bernie says he'd likely be in a nursing home.
It's life-saving, it really is. I mean, I think a lot of times people who, get institutionalized, they kind of waste away and they give up on life. To me, it's like my life has continued despite the stroke, and I've, managed to be productive with work and maintain my help to my family and my relations with my family. It's very important.
Kat makes up to 8 of these house calls a day, covered by Medicare, treating elderly patients in their own homes. But the kind of crucial support she provides is in short supply. Susan Swider is a professor of nursing at Rush University.
There is a shortage just about nationwide, and there's not only a shortage of practicing nurses, but the ones that are practicing are aging, and so are going to be retiring in the next decade or so, and we're going to need to replace them. And schools of nursing are saying that they don't have sufficient faculty.
The timing couldn't be worse. More Americans than ever, 10,000 a day, are reaching the age of 65, a population expected to live longer with chronic illness as the number of caregivers shrinks.
Just chin to chest, that's it. Stay straight. Yep, and then put your head back. Good.
Here at Rush University's College of Nursing, the classes are full, but most here will choose the higher pay, good benefits, and shorter hours of hospital work. In fact, none of these nurses in training will be qualified to provide home care when they graduate.
Rotate your shoulders forward.
Bob Ebel is the CEO of My Life, a home health care company. For the first time ever, he's had to turn patients away. There simply aren't enough nurses to care for them.
We can't hire recent nursing grads because they have to have a number of years of clinical hospital training because they're not supervised in the home setting. And so we have to make sure that we've got people who are trained and have the experience to provide for all the different things that they may encounter in the home setting. So you take that coupled with the fact that all of the reimbursements for home health providers is being slashed. I mean, we're under siege right now.
In Illinois, the crisis is even more severe because private duty nurses here are among the lowest paid in the nation. Medicaid pays $75 an hour for a home care nurse in Alaska, $52 in Massachusetts and Ohio, but only $32 in Illinois. And state budget cuts make matters worse.
When I first went into private duty nursing, I was making $24 an hour. Then there was a pay cut at $20 an hour, and now we're back up to $21.50.
Phyllis Polvey hasn't had a raise in 10 years. She's the mother of a special needs child of her own and believes caring for Hunter Richards and other medically fragile children is her calling.
Kids like Hunter need skilled care 24/7, and it's a long-term commitment. It's not something that may last 6 days or 6 weeks or 6 years. It can go on and on. So it is something very necessary.
Hunter's severe brain disorder causes violent seizures and makes it tough for him to breathe and move. He and the machines that keep him alive require constant vigilance. Without the help of a team of nurses, his parents, Mike and Paige, who have 2 other young children, would not be able to work or sleep.
We don't look at him as nurses, we kind of look at him as family. I mean, just the way that the care that they provide for Hunter is extraordinary. I mean, without them, I don't know, what we'd be able to do.
700 children in Illinois require this kind of care, but more of them are spending time in hospital beds since there are so few nurses who can look after them at home. Phyllis cares for a number of children, working 70 hours a week to make ends meet. She worries about how long she can afford to do the home care she loves when she could be making more at a hospital. The Richards worry too.
It scares us because we've talked about it, and there's no way we would ever institutionalize him. You know, we want to keep him with us, and the nurses are the only way that that's going to happen.
He's our little guy, and we love him. You know, we wouldn't do anything different.
They just hope they won't have to. I'm Barbara Pinto for In the Loop.